This video is going to teach you everything you need to know about the basics of breastfeeding. The objectives of this video are to give you an understanding of the basic concepts of breast milk supply and demand, help you apply concepts to solve problems you may encounter while breastfeeding, help you to understand the behavior of your breastfed baby, and help you to correlate what you see in your baby with what your baby needs. After viewing this video, you should be able to discuss your newborn's nutritional needs and how they can be met, demonstrate different positions for feeding, identify common breastfeeding problems, discuss common causes of those problems and things you can do for each one, describe the normal bowel and bladder patterns of your breastfed baby, and identify hunger cues from your baby. Breastfeeding sounds simple, right? You put the baby to the breast and they eat. Unfortunately, it's usually not that simple. It's easy to get frustrated when you don't know what's normal and to be expected and what's not. I hope this video will help. The first thing you should know is your baby doesn't require as much milk as you think. Did you know that when you take your baby home from the hospital, their stomach is only the size of a walnut? That means they can only hold about 1 ounce of milk. If you pump, don't worry if you don't get as much as you expect babies should be eating. Baby is much more efficient than a pump. There are 3 types of breast milk: colostrum, foremilk, and hind milk. Colostrum is the first milk your breasts produce. It's thick and rich and full of concentrated nutrition and antibodies to help keep your baby healthy. This only lasts for a few days. Then your milk comes in. It consists of foremilk and hind milk. Foremilk is what your baby gets at the beginning of a feeding. It quenches thirst with lactose and protein, but has little fat or calories. That's in the hind milk that comes at the end of the feeding. Both of these milks are important for your baby's growth and development, so make sure baby finishes at one breast before moving to the other. You may ask, how do my breasts know how much milk to make? What if baby needs more as he grows? The female breast is smart. It works by supply and demand. This means the more you give, the more you'll get. If your baby needs more, he or she will nurse longer or more often. You may feel like all baby wants to do is nurse. This is called cluster feeding. It's baby's way of saying, I need more milk. Your breasts take the hint and produce more to accommodate baby's need. It's important to your milk production to make sure you drink enough water, 16 cups or 128 ounces a day, and eat enough, an extra 330 to 400 calories each day. Breastfeeding requires baby to work too. They have to latch correctly and suck to stimulate letdown. So if your baby is hungry and angry, they may have a hard time because they've lost their patience. It's important to know your baby's schedule and watch for feeding cues. These include rooting, sucking on hands, and increased movement or restlessness. When it's time to nurse, there are many ways you can position baby. Most positions are simply for mom's comfort, but the side lying in football hold can be useful for C-section moms. The most important thing is that both mom and baby are comfortable. Once you have baby positioned, it's time to latch. Proper latch is important to prevent blisters, cracks, and other injuries to the nipple, and it ensures maximum milk output. Baby's mouth should be wide and should have surrounding areola inside, not just nipple. If it hurts when your baby sucks, you may need to check your latch. Sometimes baby will let go of the breast on their own when they are done, but sometimes they just like the comfort of the breast and will hold on, even after they are done eating. When baby does this, you don't want to just pull him or her off of your breast. That would hurt. Break suction by inserting a finger into the corner of your baby's mouth. Then you can remove them from the breast. Sometimes your baby will attempt to take the breast with them as they get older and begin to look around or sit up. They may even laugh at you when you yelp with pain. So how can you know that baby is getting enough with each feeding? Look at your baby's body language and diapers. A satisfied baby is content and relaxed, has multiple wet and dirty diapers each day, and gains weight. A hungry baby will be tense and fussy, have few dirty or wet diapers, will have dark urine, and won't gain weight. They could possibly lose weight. Speaking of diapers, observing your baby's poop can tell you a lot about baby's feeding habits and needs. Breast babies have what we call mustard yellow poop. If it's bright green, then baby might not be getting enough hind milk and needs to nurse longer. Poop color may change based on problems baby is having, foods or medications mom is taking in, and foods that baby eats after solids are introduced. Some common problems breastfeeding moms encounter are sore nipples, engorgement, clogged ducts, low milk supply, and overabundant milk supply. But is overabundance really a problem? Many of these problems have simple fixes. Sore nipples need air. You can also rub breast milk on them. Cracked nipples can be soothed with lanolin. It's odorless, tasteless, and doesn't bother the baby. Clogged ducts need warm compresses and massage. Pump or nurse more to relieve engorgement. Use a nipple shield for inverted nipples. Make sure you see a doctor if you develop mastitis or thrush. Nursing more and pumping will help with underproduction. Another problem is a gassy baby. If you notice that baby seems especially gassy and fussy, think about what you ate prior to nursing. Some of the foods you eat can affect your milk and also affect your baby. There are some foods that tend to affect baby more than others, such as broccoli, cabbage, or citrus fruits. But it's really individual to each baby. Breastfeeding isn't always easy, but it's always worth it. Finding a good support system is key. Talking to other breastfeeding moms who know and understand can be helpful. You can share your triumphs and frustrations, as well as your ideas and problem-solving solutions. Breastfeeding should be an enjoyable experience for both mom and baby. For more information on all things breastfeeding, you can visit the CDC website and the Mayo Clinic website. The Academy of Pediatrics recommendations can be found at healthychildren.org, and support can be found through La Leche League. You can also check with your local health department, WIC office, and hospitals to find out about resources and support groups in your area.